This is Virginia Kaufman. She's a senior physician assistant student at Damon College in Amherst, New York, doing a patient at the Vein Treatment Center. She's giving a talk or presentation about lymphangitis. Go ahead.
So in the body there's arteries, there's veins, capillaries, and there's the lymphatic system. The lymphatic system filters out the fluid from the tissues in the body channels, and sometimes the system can be infected and it leads to inflammation, thus lymphangitis. So lymphangitis is the inflammation of the lymphatic channels, and this is due to an offending organism getting in through the skin, through a cut, an insect bite, or through trauma. Lymphangitis is usually seen in patients that have other comorbidities such as diabetes, cellulitis, the immunocompromised patients on long-term steroid use as well. Lymphangitis presents itself over the skin as red streaks. It's almost like a snake-like line on the skin, and this is from the inflammation that it causes on the tissue due to infection. Other things that you will see are regional lymphadenopathy in the area of the infection. The patient can present with fever, chills, malaise, typical of an infection. And there's red streaks that are warm and erythematous over the skin as well. The complications of lymphangitis include bacteremia and sepsis, and that's a typical complication that's not seen in many patients, but it can happen if it's not treated accurately. Cellulitis is another complication, and abscess is another one. The workup and treatment include a full CBC with blood culture to determine the offending organism and to treat it properly with the correct antibiotic. If an abscess is present, that must be drained in order to get rid of that. 90% of patients on antibiotics do get good results and get better with this infection. If patients don't respond to oral antibiotics, the doctor would have to admit them and give them something a little bit stronger through an IV, so an IV antibiotic. Analgesics for pain, such as NSAIDs, can help as well, and warm compresses can help these patients. The prognosis for these patients is good. Usually there is no complications seen if they're treated properly in most cases.
Thank you, Virginia. So Virginia made a point about the different types of vascular structures, and these are the arteries, which take oxygenated blood to the tissues, the veins, which bring the oxygenated or blue blood back to the central circulation, and the lymphatic system, which brings back the filtered fluid out of the tissues and back into the central, is inflammation or infection of the lymphatic system. And like you said, the portal of entry is through the skin. The offending organisms, which are most commonly by cephalosporins, and first, second, like she said, they are treated appropriately with oral antibiotics and rarely require admission to the hospital for IV antibiotics. It should be noted that one should be very aggressive in treating lymphatic inflammation or infections, because with repeated infections, then the system gets destroyed. It's a very fragile system, and this could leave patients with lymphedema. And lymphedema, acquired lymphedema, is swelling that extends from the legs to the feet, ankles, and toes, and this type of swelling is a type that's seen with lymphedema, and it's called like pillow and feet, like a pillow-like appearance of the feet and sausage toes, and this is very classic for lymphatic type swelling in the legs. So this is different than the type of swelling you would get from, for example, issues related to the heart, such as in heart failure, or related to venous insufficiency. So whenever you see swelling that extends to the feet and toes, this is classic for lymphedema. And repeated infections of the lymphatic system would predispose people to have chronic lymphedema, which is a very, very difficult thing to treat. So be aggressive and treat it appropriately and correctly the first time, and you'll help the patients out a lot. Thank you, Virginia. Do you have anything else to add?
No.
This is Dr. Carol Manoukian from veins and the Vein Treatment Center. Thank you.